Reflux esophagitis is basically reflux of the gastric content from the stomach to the esophagus. Actually, there is a sphincter, lower esophageal sphincter, which prevents the acid reflux inside the esophagus. But with increasing age, increasing obesity, with smoking, alcohol, and lack of exercise, they all produce a loss of the lower esophageal sphincter, which results into the regurgitation of the gastric contents inside the esophagus, which produces burn of the esophagus, which is known as reflux esophagitis. We have all encountered reflux esophagitis sometimes during our lifetime, which is produced by heartburn, typically known as a burning sensation inside the esophagus, in the back of the chest. This is called heartburn. Another common symptom is globus. That's a feeling of a foreign body inside the throat. Another very common feature of reflux esophagitis, which is not related to the burning symptoms or globus, is cough, chronic cough. Often, these patients are tended to be treated with antibiotics and others, but the basic mechanism remains reflux of the gastric content. How can this be treated? If there is one or two episodes of reflux esophagitis, it is usually treated by local antacids like polycrol, gelusil, mucane, or reflux fort gel. But with prolonged episodes of reflux esophagitis, we tend to use number one step, a low dose histamine 2 receptor antagonist in low dose. If this doesn't work, we build it up to the highest dose. If still it doesn't work, we usually go for a proton pump inhibitor. There are lots of proton pump inhibitor like omeprazole, esomeprazole, rabiprazole, lansoprazole. But it has been found that the highest bioavailability is with the esomeprazole group, which has to be continued once daily to twice daily for at least 1 to 2 months. Along with that, certain modification of lifestyle has to be done, like smoking cessation, cessation of drinking, and daily exercise. Small amount of food are to be taken at a regular interval of 2 to 3 hours, rather than gorging a lot of amount of food for a longer duration of time. It's better to go for smaller quantities of food at a 2 to 3 hourly interval. Now, not all patients of reflux esophagitis will require endoscopies, but with prolonged symptoms or with cough or globus pallidus sort of symptoms, sometimes esophagitis has to be ruled out by endoscopy. And there is a dangerous entity known as the Barrett'S Esophagus, which is the metaplasia of the lower end of the esophagus due to chronic heartburn. That has to be ruled out by a biopsy because that is a pre-malignant condition, and preventing that can prevent you from having a disastrous condition of esophageal cancer. Other than gastric acid reflux, there can be another reflux which is non-acid reflux, which is a bile reflux. How can you understand whether it is a bile reflux or an acid reflux? If the reflux material which is coming to your mouth, it tastes sour, it is acid, and if it is bitter, it is bile. For bile acid reflux, you can hardly do better with a PPI because already the acid content is low. So in that cases, promotility agents are of help. However, exercise, smoking cessation, drug therapy, and regularity of life, like regular interval of food, these all will help into the disastrous consequences of GERD. The thing is that how you will lie down when you are having reflux symptom Number one, you should not lie down within 2 hours of having your meal. At least you must be upright for 2 hours after having meal, so you should have an early dinner. And number two is that how should you lie down? It is said that at least 30-degree elevation of the head end of the bed helps a lot mechanically by putting off the gravity. How can you do that? If you have got a cot which has got 2 stands, at the head end of the cot, below the leg stands, you put in 2 wooden blocks or bricks so that the cot lies at a 30-degree angle, or else you can make a wedge which can be ordered from a bedding store at a 30-degree angulation. If you sleep like that, the symptoms of reflux will gradually come down.